Delirium is another neurocognitive disorder that you may experience in hospitalized older adults. Now, the difference between delirium and dementia is that with delirium, there's a short onset and it occurs over hours to days, whereas we talked about dementia being more progressive in declining over a number of years. Okay, so some of the causes could be an older adult that has like an infection, like a UTI, or maybe they had surgery and now they're having an infection. They may be malnourished, depressed, electrolyte imbalances. Remember, low sodium could cause some neurological problems, and then history of substance abuse. So especially like people that have surgery or people that drink a lot, you want to know when their last drink was because they can start experiencing delirium if they're going through delirium tremors. So the causes of delirium can be remembered with the mnemonic delirium. So drugs can cause delirium. So like street drugs, but also drugs that are medications, I should say, that people take for, psychiatric diseases or, neurocognitive diseases. They could become toxic with it. Electrolyte imbalances. I talked about sodium before. People with liver failure. The liver detoxifies byproducts in our body. So there could be an increase in ammonia level in the body, and that can make people a little crazy. And hypoxia, of course, can also do that. People with liver failure also have a reversal of sleep-wake cycles so that they could become sleep deprived. Infection is another cause of delirium. Retention, both urinary and constipation, can cause delirium. Intracranial problems, I talked earlier about brain tumors. Uremia, uremic products are a byproduct of kidney disease, and uremia can cause encephalopathy. And then metabolic problems, I talked about thyroid disease, etc. earlier. Delirium is a medical emergency. It needs early intervention, and it's temporary if you have early intervention. So patients may present with hyperactivity or restlessness. They may be trembling. Their sympathetic nervous system can be triggered, so they'll have tachycardia, diaphoresis, maybe an increased blood pressure. They'll suffer from nausea and vomiting. They have a rapid personality change. They could have seizures due to, if they have a low sodium, um, they could have hallucinations, and usually the symptoms are worse during the early AM in, in evenings. They can also have like apathy and signs of hypoactivity. Delirium presents with an altered LOC. They could be extremely anxious, restlessness. They could be apathetic. They have rapid mood swings. Their family doesn't recognize the mood swings. They can be paranoid, anxious. Their speech can become incoherent and inappropriate. They could be rambling or have rapid speech. Delirium is treated by identifying the cause and treating the cause. Medications can also be used, and I know you're learning about that in pharmacology. You want to keep the patient safe, just like you would with somebody with dementia. Update your whiteboard if they're in the hospital daily, and when you need to. Encourage PO fluids, ambulation. Now, this could be a safety issue, so they need to be ambulated with assist. Vision and hearing aids, so make sure they have their glasses, their hearing aids, and manage pain and promote sleep.